Once again, you're welcome to this other session where we shall be looking at contemporary midwifery models and how we can best practice or how we can best care for those mothers who are outside there without difficulty and without making biasness. I'm still the same presenter, now Prudence Hamito. So first and foremost, we have what we call traditional and independent midwifery model. So this is one of the contemporary models that is used to make sure that contemporary midwifery care is provided. So this model is based on principles of continuity of care, and the midwife has a primary care provider. So just from the name, traditional and independent midwifery model. So that means the midwife is the primary care provider in this model, and they're supposed to make sure they continue to provide care just right from or before pregnancy, during childbirth, and even after. Independent midwives typically cares in and out of hospital settings such as home births, birth centers, and any other place the woman opts for. So you find that when we look at in a traditional way, those days people used to deliver at home, and that means we want to still use this model to reach out to people who are not able to come to the hospital. Or better still, if they come to the hospital, we want to follow them. We follow them at home to know how they are faring. So this model emphasizes personalized, women-centered care and promotion of natural childbirth. Sometimes you find other women, they prefer to do what is called water bath. And you know water bath is not possible in the hospital. So that means you are going to conduct that particular delivery from home. So this is what we call traditional midwifery. Remember, the women have right to choose which type of delivery they want. So if a woman has chosen a position they want to take during time of delivery, they have right to choose. So you just follow whatever they have chosen. The next is a team-based midwifery model. So in this model, midwives work collaboratively with other healthcare professionals, such as obstetricians, nurses, and doulas. So doulas are those people who are not medically trained, or they have no background of medical training, but they assist women in childbirth and they can help them to deliver. So those doulas, we can say like those days, for example, before the scientific part of midwifery came in, we had mothers who could assist a woman to deliver or even assist them to bathe the baby and all those things. Those are the people we are calling the doulas. Then we have team-based approach, ensuring a multidisciplinary approach to care, combining the experts of different professionals. So still on team-based model, we are focusing basically on having different healthcare professionals coming together to provide the same quality care to a woman who needs at that particular time. So we shall have multidisciplinary approaches or teams coming together to ensure that the woman is actually attended to. Midwives often lead the care, but there is shared decision-making process and coordination among the team members. So, because whatever that we are trying to handle is midwifery based, so you find that the midwife will be the person who is on the lead, and even if there are other people trying to assist, but she should be among the team. That means you are not going to be left out as a midwife. We have midwifery-led continuity model. So this model focuses on providing also continuity of care by the same midwife or small group or team of midwives throughout pregnancy, childbirth, and postpartum. So as a student midwife right now, at some point you find that we will allocate you with maybe a mother who is about 3 months old, 3 months pregnant, or even less, or even right before, or somebody who is planning to get pregnant, and then you start following that same person. So a same midwife or small team of midwives care which is going to be provided. So you are the same person who will attend to this single mother from preconception, from preconception to pregnancy to delivery and after childbirth. That means you will know this person in and out, and this will help us to give quality care. So midwives follow the woman from prenatal period through birth and into postnatal period, providing comprehensive and personalized care. So that is how this model will help us to reduce specifically and improve outcome of maternal mortality. So this model has been associated with improved outcomes. If you are to look at this, remember in the earlier on, I talked of significant numbers or shortage of midwives who are supposed to provide this contemporary midwifery care. So if at all we had a vast number of midwives, you find that each mother would be allocated to a specific midwife. By that, we would have come down with the high number of maternal mortality by now. So this is one of the models that can easily give us better outcomes, higher satisfactory rate, and reduced interventions. We have integrative models. Integrative models combine midwifery care with other healthcare services, such as maternity clinics or hospitals. So in most cases, when it comes to integrative models, we are looking at, let's say, community outreach. So in this case, when we go for community outreaches, it's something which is combined. We are not only sending out midwives, we are not only sending out nurses, or we are not giving specific care, but we give combined care to whoever will come to that gathering. So through doing that, you find that we are actually extending midwifery clinics or hospital to people who cannot reach. So this model aims to create seamless care experience by integrating midwifery care with other access to medical interventions when needed. So the goal is to provide women with various options to ensure that care is tailored to their needs. So that is how integrative models work. So when you look at those times where people go for outreach, you find that they will need a midwife, they need a nurse, they need a clinical officer, or maybe a doctor, or they need first aid team members. That is what we call integrative model or care. So we have another type of care which is also in midwifery, and that is what we call respectful maternal care. So when it comes to respectful maternal care, we are looking at care which is providing healthcare service that upholds the woman's dignity, autonomy, and rights throughout the maternal journey. So it involves treating women with respect, kindness, and cultural sensitivity while ensuring participation in decision making. So as you're providing respectful maternal care, all you need to do or all you need to know is that you respect, you provide shared or uninformed decision making among these women, respect and give them right to participate in whatever decision you want to make. So what are the components? We have few components of respectful maternal care, one of which is dignity and privacy. Remember I told you that being a mother or being a woman, they need to be accorded the respect and dignity regardless of their social status, regardless of their financial status. All of them need dignity and privacy. So respects women's privacy, modesty, and confidentiality during all interactions. So by doing that, you're going to be maintaining a supportive and non-judgmental environment that preserves the woman's dignity. For example, you cannot examine a woman's breast in an open place. So you need to provide privacy. By providing privacy, you are according that person that dignity. Then we have autonomy and informed consent. So respecting the woman's right to make informed decisions about their bodies and health care. I think we have talked about informed consent very many times now. So on no account are you supposed to touch a woman without their consent. Even if you're in a hurry, you make sure you get the consent. So ensure women can access accurate and comprehensive information about the care you are going to give for them to accept. They have right to refuse whatever care you want to give to them, so long as you have not explained exactly what you want to do on them. So we have communication and shared decision making as the third component. So communication and shared decision making helps in promoting open, effective, and respectful communication between the healthcare provider and the woman. So by engaging the woman in shared decision making, it helps them to know that they are having values and rights over their body. So you help them to open up and trust you with whatever problems they have. It helps you to communicate freely with them at the time when you need to get information from them. So if you don't promote open and effective communication between the both of you, you'll find that this woman will not tell you anything, even if you know there is something more that you need to know for you to provide a good service to them. So the next is emotional support and empathy. As a health worker, not just as a midwife, you should be empathetic but not sympathetic. So you should provide that emotional support and empathy to women throughout their maternal journey. That means at one point you will have to put yourself in their position. But by putting yourself in their position, it should not stop you from working on them. You know the difference between empathy and sympathy. So acknowledging and compensating, compassionately addressing women's fears, anxiety, and concerns will help you to support them emotionally. So some people you can just, that's why it's important for you to allow the women to walk in when you're already seated at your examination table, or maybe seated in a room. So it helps you. Some emotions can be seen physically. You can see it when somebody walks in. Then you know that this person is not feeling well. Fifth is cultural sensitivity. Recognizing and respecting women's cultural beliefs, practice, and tradition. Just like I said, the woman does not want the placenta to be discarded in the hospital. Pack it and give them. The woman has refused for a male midwife to examine her because culturally, no another man should touch a woman. Respect it. That is what we are calling cultural sensitivity. So adapt to the care to meet individual cultural needs and preference. So you should not do things. Let's say we have male midwives these days. And now when a male midwife presents and a woman refuses for the male midwife to examine her, she has right. Culturally, maybe there are some things which are attached. So you need to respect that and allow the woman to, or you inform a female person to come and assess. So that is all about the components of respectful maternal care. We have benefits. I think this respectful maternal care can carry a lot more benefits than what I have on the screen. So first and foremost, we have improved maternal satisfaction and well-being. Because of the respect you accord this person, you find that these women are going to feel satisfied with whatever service you are giving them because of the respect that you accorded them. Then an increased likelihood of positive birth experience. Most times, if you treat these women well, they are going to enjoy childbirth. Even if they're undergoing the natural physiology of labor, you find that birthing experience will be something. Like every time they'll feel like if you want to give birth, there's a specific hospital or specific nurse or specific midwife who can attend to you and you feel like, yeah. Then enhance trust and cooperation between women and healthcare providers. By this respectful maternal care, you find that there is that cooperation between the midwife and the woman in most cases. Reduction in maternal morbidity and mortality rate. Of course, if we have seen from the previous slides where we are talking about the components of respectful man. If we follow all the components, you find that this woman can open up and tell you everything which is wrong. By that, you can easily identify complications, and by doing that, we will reduce maternal morbidity and mortality rates. So though it's having benefits, we have barriers and challenges also. So lack of awareness and training on respectful maternal care practice among healthcare providers. This comes in most cases because of the shortage of midwives or healthcare providers. You know, when you're tired and you have a lot of mothers, there's 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 going to be that barrier. You feel like you're too tired and you don't want any nonsense from any mother. So if there could be awareness and training on how to respect mothers by health workers, then it will help. Systemic factors such as limited resources, time constraint, and understaffing, I've just mentioned. Limited amount or limited number of shortage of staffs. Then sociocultural norms and bias that may impede the provision of respectful care. So much as we want to follow or we want to be sensitive about culture, there are some norms and which are really biased and will make providing care to be really difficult, and yet you have to follow them also. So that is that for today's session. I will end here. Thank you.